think the Digital Academy is really, really important because without the workforce that's got the digital knowledge and skills, and I include in that the leadership skills, the skills in clinical change, and the expert knowledge about data science and leading technology changes, we can't transform our NHS. We can't transform the way we work. And as we've seen in the COVID pandemic, there's a real advantage to working with digital technologies. It can really help us to change the way we work, to deliver the long-term plan, bring care closer to patients.
The first really is around supporting our own continuous professional development. So clearly technology and digital services are always rapidly changing, and to ensure that we can deliver the best of modern digital methodologies and technologies, it's important that we engage with the Academy to provide that continuous professional development alongside some of our affiliations with professional and registered bodies in this space.
The move of informatics being simply a support function to being the heart of how we enable better processes of care is super critical. And we're seeing it. We're seeing it now in a wide variety of organisations, that those with digital informatics skills are giving us with the greatest range of people, with the greatest range of skills to take part in those processes.
This is a real opportunity to look at digital in a way that helps you understand how you can integrate systems, how you get data out. So we're not digitalizing services for digital sake. We're really doing that so that we can get data and insights from the digital processes. But also in that transformation, we can actually reduce burden to organisations, make sure that we're collecting the data in the most effective way and most complete and most timely. All those things that informaticians have been struggling with in the NHS. This is a really good opportunity to see how digitalisation can help you in that context.
I think it supports in a number of ways. Firstly, obviously with the content, so the very carefully considered content to make sure that people do have the requisite knowledge and skills to lead digital transformation. But importantly as well, I think it's about the community and the network that's built, and that goes way beyond that learning and well on into people's careers.
So for data and analytics colleagues, I'm really keen that you participate in this course. I think it's a great program. It will give you a grounded information around what digital transformation is. It's quite a practical course, and also will actually allow you to start understanding how data and analytics are actually hand in hand necessary with digital transformation.
We need many more nurses and midwives, and people from all professional backgrounds, and people with more with very diverse backgrounds beyond their professional role. So thinking of people from the protected groups as well, so that we have real diversity of thought in the classroom that then comes back out into the workplace in order to deliver really good digital solutions and digital advancements in the way that we work.
But not only do we need more CCIOs throughout the NHS, we need a clear pipeline of future CCIOs, of people who've shown a strong interest in these sorts of clinical changes, but who are not yet, understandably, ready to become CCIOs themselves, who want projects to take part in, who want this to be alongside their day job, with a view to taking on the significant responsibility of being a CCIO at some point in the future.
And I think it's really important as leaders with the wider expert professionals in this field, that we create that vibrant community that could be of benefit in a number of ways, just simply networking, exchanging ideas and thoughts, but also the opportunities of collaborating on agendas and programs where they do exist as well. So I think there's quite a lot in it for us as CIO leaders in engaging with such a great agenda.